So in the dog and probably in the cat, the most common cause of otitis is an underlying allergy. It's usually atopic dermatitis, again, the environmental allergy, or sometimes it's food allergy. And so that has to be worked up. And we can even see dogs who have no other clinical signs but have otitis externa, and sometimes even unilateral otitis externa that have an underlying allergy. So again, the whole thing about dietary trials, really strict, are important. Many otitis externas are complicated by bacterial infection and or yeast infection. Of course, that has to be dealt with as well. That's probably the first, most likely. Then the second is severe bacterial infection with a difficult to clear infection such as pseudomonas, which can be a problem. And what sometimes veterinarians don't realize is that even though this is a severe bacterial infection, it's very important to put those dogs on corticosteroids, because first of all, it's an otitis, it's an inflammatory disease, so we want to reduce inflammation. We'll make the dog far more comfortable. If there's swelling of the ear canal, which there usually is, then using corticosteroids will reduce that inflammation, reduce that swelling, so that the veterinarian has a less painful dog to look at and can actually do a decent otoscopic exam in. So I would say those are probably the two most common. Less common, but perhaps a little more common in older animals, is some sort of neoplastic process. If you talk about acute otitis, one that the dog was okay today until noon and then developed otitis, that's oftentimes a dog who's got a foreign body in their ear, spear grass, a so-called foxtail, things like that. Most of the time, most general practitioners in an area that have those kind of grasses that are endemic, they recognize that right away and can look in the dog's ear.